Hello, hi, welcome back to my channel. Today let's just discuss a bit about upper eyelid blepharoplasty or upper eyelid surgery. Now, as we know, eyelids is a very important structures in our body, and in plastic surgery, one of the most common procedures that we do is what we call as surgery of the upper eyelid or blepharoplasty of the upper eyelid. Now, usually the indication for upper eyelid blepharoplasty, there are two types of surgery that we commonly do. One is what we call as the oriental eyelid surgery, and the other one is for removal of the redundant skin in the upper eyelid. Now, before we go into detail the type of procedures that we can do, let us just revise a bit about the anatomy of the upper eyelid. The upper eyelid usually consists of two layers of structures, what we call as the lamellas. So we have the anterior lamella and then we have the posterior lamella. So the anterior lamella consists of skin and the orbicularis oculi muscle, and the posterior lamella consists of the conjunctiva and the tarsal plate. The other thing is, when you look into the eyelid, you will see there is a fold there. So this is what we call as the eyelid fold. And in oriental population, when you look into, for example, like the Chinese and the Koreans and the Japanese, you will see as if they don't have a fold. But in reality, they actually have a fold. It's just that the fold is actually very low lying. The fold is actually formed when there is an incision of the levator aponeurosis to the skin. So when the incision is very low, you can see as if there is no fold. Now, for the oriental eyelid blepharoplasties, there are two types of procedures that is commonly done, what we call as an incisional and non-incisional. So basically what it meant is, for incisional, there is surgical incision is done to the skin, and whereas there is non-incisional, there is just involvement of sutures placement. Now, for non-incisional oriental eyelid formation, the sutures are placed at certain distance, and by doing this, you actually reattach the aponeurosis to the skin, and once the patients look up, the fold will be created. There's a new fold creation. Now, the advantage of doing a non-incisional is that it is actually easier to do and faster, and there is also no involvement of an surgical incision. So meaning that there will be less risk of bleeding and recovery should be faster. But the disadvantage of doing this is that sometimes the result might not last long, and because there is no creation of fibrosis of tissue to hold the new fold. And the other types, when we talk about eyelids for oriental, is incisional. That means in incisional, you have to open up the skin, expose the muscle, dissect the muscle down, and then expose the levator aponeurosis, and this aponeurosis will be reattached to a higher location to the skin. The usual landmark is about 4 to 6 millimeter from the eyelid margin, right? Okay, now the other types of upper eyelid surgery, like I mentioned earlier, is what we call as removal of the redundant skin, especially in the older population. When you look into the eyes, you feel as if you look tired, but you don't really feel tired. It's just that because the eyelid is folded, the eye appears heavy. So for this type of surgery, what we do is we remove the excess skin and the big part of the orbicularis oculi muscle, and then we reposition back the eyelid to a new place. So you will end up with a fresh look over the face. Now, what are the problems or what are the potential risks for these procedures? Again, because this is a surgical incision, you still have risk of bleeding, infection, and then there are risk of foreign body if the sutures does not dissolve well. But then again, by understanding these risks, the necessary steps and precaution can be taken for uneventful recovery. Alright, thank you.